morning, and thank you, HitLab, for having me here. Speaking of the importance of building community and partnerships, being here, especially at the HitLab Summit, is amazing. With such a small team, Stan, Jerry, Ainsley, Pallavi, and I'm sure some others who I haven't named. Putting this all together for all of us in the next 3 days is no small feat, so I do want to acknowledge their work in putting together the summit. So a little bit about myself. I come from 3 different intersecting worlds. The first is I was an occupational therapist for about 12 years. I was working primarily with special needs kids, and I noticed that they were not eating the best foods, and I thought that maybe this might contribute to some of their behaviors, inattention, et cetera. And that kind of led me into the direction of looking at a public health policy around food. So I decided to go back to school, and I got a public health degree. And during my time in public health school and a little thereafter, I got really involved in the local community. One of the associations here in the city was the Public Health Association of New York City, which is an affiliate of the American Public Health Association. And through that work, I was able to build community in terms of putting together events that educated the public about public health issues that were relevant, especially timely and relevant. I remember one very interesting and timely event we put together was on Hurricane Sandy and building resiliency and learning from that public health emergency that we faced as a city back in 2012. And finally, digital health. So I've been working in digital health for the past 8 years, 8+ years probably. And so I've worked at a number of startups, and finally I've landed at Samsung Health this past year. So just a little few pieces of advice. One is to get involved and find your people. So attend conferences and events just like these. Join local or virtual communities of something you're passionate about or where people share the same goals. And if it doesn't already exist, create your own community. I'm putting a shameless plug up here. I just started this LinkedIn group probably over the last week called Rehabilitation Professionals in Digital Health. And I decided to do that because I very rarely find occupational therapists, physical therapists, speech therapists, those working in the rehab field at places like this. And just last HitLab Summit, I was fortunate enough to meet some of the folks at SQUEG, which was an age-tech collaborative company, as well as an occupational, built by occupational therapies, basically testing grip strength. So I found that really interesting, and every time I run into a rehab professional at digital health events like this, I get really excited, and I love to hear, their own personal journey into digital health. Another piece of advice is to nurture your relationships, and of course sometimes life gets in the way, but don't be afraid to reconnect. People tend to be very understanding, when you reach out after a long time, because they have other life events too that have gotten in the way of keeping that relationship up. And lastly, you never know what one conversation may lead to. And I'm going to start back at the very top, up there, with attending conferences and events like these. So a year ago, I was out in the audience, and not many people know this, but I was laid off from a startup I was working at. And so it was probably a week or 2 out from that very unexpected event in my life. And I decided to get out of my apartment and show up at HitLab. And events like these really helped me understand what it was about digital health that I was passionate about. I was kind of looking at different job listings, and I was like, I could do that, I could do that. Well, I can kind of do that, but I'm not that into it. And speaking to folks that are in the audience, just like yourselves, I was able to really narrow down what it was that I wanted to do next. And I decided to set my focus very narrowly and looking at partnerships, because that's what I love to do. I love connecting people. I love building together. And so that's why I landed here at Samsung Health. So our vision for Samsung Health is to build a healthier future for everyone. And how do we take on such a lofty vision? Well, we can't go at it alone. So I'd like to mention a few of our notable partnerships and ways that we work together to achieve a common goal. So these were some of the startups and scale-ups featured at Health in our Samsung booth. And we had a few of these companies running demos of their product within our booth at Health. And how do these companies work with us? Well, one way to get started is to utilize one of our software developer kits. So these are ways that companies can plug into our Samsung Health ecosystem. The first is Samsung Health Stack, which is used for medical research and clinician service use cases. The second is Samsung Privileged Health, which is used to obtain raw sensor signal data from the Samsung bioactive sensor on our watches and process data with our differentiated features. And lastly, we have some Samsung Health SDKs for different devices. So for example, a third-party device can plug into a Samsung phone, or a third-party equipment such as a treadmill at a gym could communicate both ways between our Samsung watch. So this is just illustrating one of the partnerships that we announced at Health, which is between Samsung Health and a company called Be Well Connected Health. No, that's okay. So sorry about that. Let's see. All right. So soon, this partnership will allow Samsung Health US users access to their personal health data and provide actionable insights when they matter in real time. And the objective of this partnership is to close the circle and solve for the fragmentation that consumers experience today. Basically, the general population doesn't know the next step to take when they receive certain types of data. So what this will do is pull information together at the fingertips and provide a longitudinal health record that stays with them through life. So if you think about how many different logins you might have to access your patient portal, and if you're seen at various healthcare systems, how many different patient portals are you a part of, as well as your insurance plan and your pharmacy benefits. So what this will aim to do is link all of these pieces together to create a more seamless experience. So some example use cases are if a child needs a tetanus shot, the parent will receive a push notification with a link to schedule an appointment. So that makes that whole process easy. Number one, you're reminded. Number two, you're provided a way to take action on that data that you're provided. A second use case might be filling a prescription. So your app could notify you that one, you need to fill your prescription, and then kind of look around and see what the most cost-effective way to obtain that prescription might be. So this Samsung Health app can notify you that it's cheaper to pay cash versus using your pharmacy benefit. And in addition to that, it might be able to push a coupon over to the patient. And here is a clinical use case at Samsung Health and an example of a partnership. So in 2017, Samsung partnered with Kaiser Permanente to develop a cardiac rehab program, a virtual cardiac rehab program. So utilizing the Samsung Galaxy Watch as well as the HeartWise mobile app, which is available on both Android and iOS, And all of that information from the watch and from the phone app on the patient side is connected to the clinician dashboard. So this is a web-based clinician dashboard in which the care team can then receive information about patient compliance with exercise, any patient self-reported symptoms, and just general information about heart rate during exercise. So clinicians can get notified if the patient is exceeding their prescribed heart rate. So this program with Kaiser has been ongoing since 2017, and currently we are looking to pilot with a few healthcare systems. Kaiser is kind of its own little bubble, its own unique payvider environment, and so in this largely fee-for-service US environment, we'd like to find a few healthcare systems to test this out. So if anybody's in the audience from a healthcare system that might be interested in being a pilot location, definitely please find me. Lastly, I want to highlight some other work we are doing, and at CES this coming January, Samsung Health and Age Tech Collaborative from AARP is putting together what we're calling the Samsung Health House. And what this is, it will be showcasing innovations from Age Tech Collaborative's portfolio of startups, and it will illustrate how a smart home ecosystem built on Age Tech can make aging, healthy living, and supporting independence easier for all. So as a visitor to the Samsung Health House experience at CES, you'd be able to walk through this home and see some of the technology in a mock living room, kitchen with appliances, a bedroom, as well as a bathroom. It should be pretty interesting, and if you are going to CES in January, please come check it out. One of the future technologies in the bathroom, for example, is a toilet in which you can actually get your blood pressure read while you're sitting on the toilet. So just ways that we can capture data in the home without being intrusive, without the patient having to do anything, ways that we can make that data capture more passive will definitely allow for that experience to be, seemingly invisible. And then it will enable caregivers, the home occupants themselves, some meaningful data that they can then take action on, and that is the whole concept behind what we're doing at Samsung Health. So if anybody wants more information about the SDKs, the HeartWise Cardiac Rehab Program, you can use the QR code there to get a little bit more information. And I just wanted to end with this picture. It is from the book It Takes a Village by Hillary Rodham Clinton. And it shows how many different people of different skill sets come together to solve a problem together. But also, existing here is some infrastructure in place that makes it possible. So again, as an acknowledgement to this community and to many other communities that I've been a part of, that has kind of been my existing infrastructure that makes my work possible. So thank you, everybody.